Welcome back to the show, everyone. Are you turning 65? Well, Miriam Vega from Mint Insurance Agency is here to tell us all you need to know about enrolling in Medicare.
100% correct. Excited to be back.
Hi, Miriam. Nice
Hello.
to have you back.
Thank you.
You're always a wealth of information, and I think this is very valuable for our viewers. So just start off by telling us what are some of the basics that people need to know if they're approaching the age of 65.
Turning 65 can be so exciting, but yet confusing, right? Why is that? Because of the Medicare options you have coming your way. Medicare consists of 4 parts, so we're going to keep it so simple today and hope to really get into what's truly important and what you should be aware as you turn 65. So we'll start with some people still work at the age of 65, right? So it's confusing. They think, do I stay on my employer coverage or do I shift over towards Medicare? Well, those options come into play, and that's truly when you should contact someone that's licensed, like someone in our team, so we can really look at your options. And what are those options? Well, if you're still working, are you covering someone with that employer coverage, or is it just you, right? So we educate on the basics of Medicare. Part A and Part B usually comes at the age of 65. And I say usually because there are times that individuals that have been disabled for over 24 months by the state of California, 100% disability, can also receive Medicare. Or individuals that have been diagnosed with end-stage renal disease. These individuals will typically also receive Medicare, even though they're under 65. But if we come back to those most commonly that are turning 65, there's a 7-month window to make some choices. This 7th-month window consists of 3 months prior to the 65th birthday, the month of their 65th birthday, and up to 3 months after their 65th birthday to avoid any late enrollment penalties. Wow. Before we get into penalties, Medicare Part A comes automatically if you worked more than 10 years or 40 quarters in the United States, you are a legal resident or citizen of the United States, and reside in zip codes where Medicare Advantage is available.
Oh, it's not available everywhere.
Well, Medicare Advantage plans can have different type of options, right? Some can be for people with chronic special needs. Some can be for people that have both Medicare and Medi-Cal. Sometimes there are certain areas in the country where there's only a Medicare supplement option, but we'll get into that. So as we come back to Medicare Part A and Part B, that's the original Medicare. Part B is 80% coverage for medical needs, and then you're left with that 20%. And that's where people start wondering, well, how do I supplement that 20%? And that's where terminology can take a detour, because you can easily fall into calling an 800 number and saying, hey, I need a Medicare supplement. But in reality, you're looking for options, right? Like a Medicare Advantage, which could be an HMO, maybe a PPO option, or truly a Medicare supplement option. But once again, when it comes to the basics, Medicare Part A and Part B is your original Medicare. Part C is what we know as Medicare Advantage, and that's what we see most commonly, and especially here in Southern California. We have so many Medicare Advantage plans available. And so that brings you to that confusion of, well, which one is best for me? Right. What works for me? Do I stay on my employer coverage, or do I go with one of these Medicare Advantage HMOs?
Right.
It gets very confusing, but that's what we're here for.
And you've been doing this for how long, Mary?
I've been doing this for over a decade, and I love what I do, and I love to share that our team has grown tremendously. So we have a full force behind that is ready to take your call, ready to meet with you, talk about your benefit options, review what you currently have with the employer, and compare it to your Medicare Advantage options. See if that's a better fit for you. And we do appointments in home. We can meet at the center right below. We can meet at a local coffee shop. We can meet at our office. We can meet telephonically or virtually. A lot of those individuals turning 65 are really now into, hey, let's meet through a Zoom call. Whatever works. The point is to initiate that contact and to know which route is going to work best for you as you age into Medicare, and ensure that you avoid any penalties, really.
Yeah, so is that the main repercussion if somebody isn't proactive in seeking coverage?
I would say so. And of course, your health is so important. So why would you chance it and leave it to God knows what, right? Or whatever happens, happens. I don't often come across people that leave that as a rare priority. I think all the contrary, we really like to connect with people that are actually turning 65 in the next year. So if you're turning 64 this year, this is a good time to reach out, give us a call, 1-888-225-6468. We're ready to take your call. Just talk about what's ahead, right? Plan accordingly. Let's help you with applying for Medicare if that may be the case. Or if your employer coverage is a better option for you, we want to make sure you know how to say no thank you to Part B, right? We're going to give you that guidance, that step-by-step as you get close to turning 65.
If there happens to be a situation where somebody misses that initial enrollment period, how can you help them?
So it has happened before, and unfortunately, that's when if you didn't at least have a prescription drug coverage, whether or not you're on prescriptions, you start seeing those penalties accrue. And if you don't have credible coverage from the employer to prove that you did have credible coverage, then that's when those penalties can come into play. And if you miss your initial election period, which is that 7-month window I shared, then you may try to enroll during the general enrollment period, but you would have to wait months. And as you wait for that amount of time to go by, you may have medical needs, right? And you're gonna have to be paying for those out of pocket where you could have avoided that just by reaching out and knowing about your options.
Right. How long does that process take when somebody reaches out? Let's say they are, maybe turning 64, they're a year away, they want to find out, as much as they possibly can, knowledge is power, right? So that initial conversation with Mint Insurance Agency, how long of a time period should they think about dedicating to learning as much as they can?
I often get calls from people that are still working, right, and turning 65 soon, and I love when they just are proactive with it. Give us a call 6 months prior. Let's just talk about where you are currently at. It's just a conversation.
Right.
It's seriously like a 10-minute conversation, and then just getting to know each other a little more and looking at the roadmap ahead. As we get closer, that's when we start having communication and advising on whether or not, hey, allow me to help you apply for Medicare Part B, or, okay, you're gonna stay on the employer coverage, that's fine, just make sure that it's creditable. And at the end of the day, even though you have a 7-month window, I always like to do things ahead of time. So for instance, if your birthday is in July, you have April, May, June. Let's get in touch in April. Let's schedule an appointment. Let's talk about your current needs. Have you even been to the doctor in the last 6 months? Do you even know if you have a diagnosis that can qualify you for additional benefits? When it comes to Medicare, contrary of what many people may believe, Medicare Advantage plans also create special need plans that are designed for people, let's say with diabetes or chronic heart failure, and they're not going to penalize you for that. On the contrary, these plans are designed to give you additional benefits. So it's so important to have this type of communication and really engaging relationship between the person who is Medicare eligible and a licensed agent like ourselves.
Right. And you're there just to walk them through the entire process. It doesn't stop. Your services don't stop as soon as they enroll, right? You're
Of
there
course
to
not.
nurture them going forward.
For us, it's a lifelong commitment, right? It's making sure that we're there for their Medicare needs through their lifetime. Why is that? Every year, even throughout the year, our benefits are, I'm sorry, not our benefits, but our needs change. So it's beautiful for us to receive a call midway through the year saying, hey, Miriam, I fortunately no longer have this diagnosis, right? What other options do I have? Or unfortunately, the contrary, Miriam, I was diagnosed with this situation. Is there something that can better fit my needs? And not just that, but Medicare Advantage plans come with so many extra benefits, so many extra things that often enough, Medicare eligibles, the beneficiary, does not know how to utilize them. So that's what we're there for. We do that 30, 60, 90, right? 30 days after you enrolled, did you receive your card? Does it have your doctor's information according to what you requested?
Right.
And help you with your first appointment, help you order additional benefits that you may have forgotten we talked about on our initial conversation.
Sure.
And really anything that you may need. We're really happy to be customer service oriented.
Fantastic. Well, let's flash that phone number one more time on the screen.
We're happy to take your calls. Phones don't stop ringing. It's that time of the year, and it's that time of the year all year long. Over 10,000 individuals turn 65 every day in the United States.
We'll see you next time. Thank you.
We'll see you soon.
You're watching This Day on Village TV. We'll be back after these messages.